to the Doctor Is In television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon right here in beautiful Monterey, California. Thank you very much for joining us. Today I am delighted to welcome as my guest the distinguished pathologist, board-certified pathologist, Dr. Hugh Wilson. Dr. Wilson, thanks for joining us.
Happy to be here, Dr. Morwood.
Dr. Wilson, you've been on the program before, and we appreciate you coming by and teaching us so much. Today we're going to talk about infections, and more specifically, we're going to talk about something that the public doesn't hear a lot about, and that's fungal infections. So before we get to that relatively uncommon fungal infection, Dr. Wilson, could we back up and just summarize what we mean by a bacterial infection and what we mean by a viral infection, and then that'll segue us into fungal infections.
Well, if you recall back to the days when you and I were biology students in college, we said there were three kingdoms, right, of life. There were the bacteria, the plants, and the animals, right? And then somewhere lurking out there were the viruses, because theoretical biologists aren't really sure if they're alive or not. So they kind of have this sort of category off to themselves by the side. Nowadays, now that we can sequence DNA, the theoretical biologists tell us that there are six. I'm going to stick with the first three.
So theoretical biologists tell us that there's actually 6 different life forms?
Yes.
On Earth?
Yes.
Now see, Dr. Wilson, every time you come on this program, I learn a lot. Can we summarize that? I've heard of prions, right?
Yes.
Now is prion sort of just a snip of DNA, and we're not sure if that is alive, but
Exactly.
it can replicate?
So, you know, the three basic functions of life, right, are the ability to consume energy, produce waste, and reproduce. Now, viruses and prions cannot do any of those three functions by themselves. They have to get inside the cell of another organism, and then they subvert the mechanisms of that other organism and to do those things for them. So the question is, are they really alive, or are they a carry-on?
Okay.
So aside from those,
sort of a piggyback.
Yeah, they piggyback
organism.
on. Right.
Okay, but certainly we know about bacteria. Everyone probably has heard of staph and strep. People get staphylococcus. And in fact, there are many different types of staph, and every human being has staph on their skin, and that doesn't mean they're infected. It's just colonized there.
Exactly, they're populated. It's called, in bacteriology, we call that the normal flora. So there's normal flora of the skin, and there are normal flora of the upper airways, and there's normal flora of the GI tract, because the GI tract is not sealed off from the outside world, right? It's open at the mouth and at the anus. So it communicates with the outside world and all those bacteria.
Okay, so for example, common in the colon is E. coli.
Correct.
And we need E. coli, right? It serves a function.
Correct.
It helps synthesize some vitamins and process some food and the waste, etc. So it's not. So we're in contact with bacteria all the time, and our bioflora is significant, and it's oftentimes helpful. But when does that bacteria become invasive or unhelpful, causing an infection?
Typically in a couple of situations. One where you have a bacterium in the wrong place. The bacteria that live in the colon don't do well on the skin. We can deal with the normal staph and strep that live on the skin and in the upper airways. Even small breaks in the skin don't typically turn into a staph infection. They can, but not typically. But if you were to have E. coli or Proteus or Pseudomonas, one of those colon organisms in the skin where they shouldn't be, that's a big problem.
Okay.
And then the other time when a normal flora bacterium can cause an infection is when we have a problem. The bacterium is normal, but we have a break in the skin, we have some other illness, something that compromises our defenses, because you know skin is our biggest defense,
right,
that then results in a bacterial infection.
Okay, so commonly people, if we say it's a bacterial infection, it can be staph or strep, rarely, or it can happen, enterococcus, enterobacter,
yes.
etc.
Yeah.
But those are all well-known, described bacteria and infections, and in fact most of them respond to antibiotics. Isn't that correct?
Yes, that's correct. There is an emergence of bacterial resistance over time, but so far, fortunately, our pharmacologist friends have been smart enough to come up with antibiotics that can treat even the resistant organisms or combinations of antibiotics.
Okay. So, actually, Dr. Wilson, please come back again and we'll talk more in depth about bacterial infections. But the second group that we want to summarize, mention briefly, are viral infections, correct? Now, when we talk about the common cold, isn't that caused by a virus that's not a bacteria?
That's correct. And so viruses, bacteria can do those three things. Bacteria can consume energy, produce waste, and reproduce themselves. They're different than human cells and plant cells, but they can do those three things, which viruses can't. But viruses, if they contact you, they can get in, they have this ability to sort of open a door into a human cell, and also plants and animals. There are plant viruses and fish viruses, and they're ubiquitous. But they can get inside the cell, and then I liken them to a little terrorist, because it then takes over your mechanisms for making energy and for reproduction and tells your cell to reproduce me, the virus.
Okay, so is it true that the virus is like a strand of DNA?
Yes.
It can insert its own DNA sequence into the DNA of another cell.
That's correct.
And that way, when the cell reproduces, the viral DNA sequence is reproduced.
Correct.
Now, before we go on, Dr. Wilson, this stuff is so fascinating to me, and you're always teaching me a lot. But haven't some viruses been implicated in cancers? For example, if a virus inserts itself into the cell in the lining of the colon, and that cell starts to replicate itself, hasn't that been implicated in cancer?
Yes. So human papillomavirus in cancers of the head and neck, and also the female cervix, and then also the virus that causes mononucleosis,
right,
has been involved in some the pathogenesis of some lymphomas.
Right.
And so yeah, there are viruses, and those are called they're called oncoviruses, and once the viral DNA is inserted into the human DNA, it's called an oncogene.
Okay.
Yeah, so there are viruses that are thought to contribute to the development of cancer in multiple sites.
Okay, so we've summarized bacterial infection: Staphylococcus, Streptococcus, rarely Enterococcus or Enterobacter. We know that there's a normal bioflora. E. coli is in our gut, in our colon. Our skin is covered with staph. And then you summarized very well for us viruses. That's the cause of the common cold, of course. And the virus needs to get into a cell and then take over the reproductive system of the cell so its own DNA sequence gets replicated, correct?
Correct.
Okay.
For example, in the laboratory, if I may interrupt you for just a second, we can take a bacterium and we can put it on a plate of just agar, right, and a few nutrients, but no cells, and the bacterium will grow there. If you put a virus on that same agar plate, it won't grow. You have to put the viruses into a cell culture to make them grow.
Got it. Okay. So a virus needs another cell. It inserts itself into it, its own DNA sequence, and takes over that replication.
Yes.
Okay. So, which leads us to our topic today. There's a whole other group of microbes that cause infection, and that's fungi.
That's correct.
Now, Dr. Wilson, before we go on, you're a fan of gourmet food. Now, mushrooms are fungus,
Yes,
or are fungi, correct?
Yeah, they are.
But they don't cause infections.
Correct.
In fact, although there are some poisonous mushrooms, we are delighted to eat mushrooms, correct?
There's nothing better than truffles. So
Right.
most fungi, I say fungi, some people say fungi,
Okay.
it's a difference. So it's interesting, fungus, the adjective is fungal, and then the plural can be either fungi or fungi.
Okay.
I'm not an entomologist. But yes, most of them are completely harmless. There are only a few that tend to cause illness.
Okay. So how do we better describe or define fungi? Do they reproduce themselves? Is it like a plant? Is it invasive? Are there fungi everywhere, like there are bacteria everywhere?
They're quite ubiquitous. They're different than bacteria in that bacteria, for example, have a cell wall, but they don't form a nucleus. So plants, animals, and fungi, they do have a nucleus, as opposed to bacteria. So the bacteria are called prokaryotes, the others are called eukaryotes. Animals do not have a cell wall. Plants and fungi do. So they're eukaryotes, but with a cell wall. And yes, they can. They can consume energy, produce waste, and reproduce themselves just like a plant or an animal can.
That's fungi.
Yes.
Okay. So how and why, how do they go about causing an infection, say, in a human being?
Most often it's because their reproductive form, like the mushroom is the fruiting body of a fungus, the mushroom forms spores, right? Those spores are often airborne and can be inhaled. And when fungi do cause infection, that's the typical route. And of course, living here in California, I think everybody's probably heard of valley fever, sometimes called San Joaquin Valley fever.
Right.
And that's the very common one here in the Salinas Valley especially, and it's transmitted by inhalation of spores.
Okay. So if we define an infection as the abnormal invasion by a microbe that is not supposed to be there, invading into the tissue, is that the same as a fungal infection?
Yes.
Okay. So are things like tuberculosis, is that a fungal infection? And onychomycosis, that's the scientific name for a fungal infection of the toenails.
Correct.
Isn't that correct?
Yes. Tuberculosis is an odd organism. It's not a fungus, but it's not really a bacteria. It's called a mycobacterium. It's somewhere in between. But the onychomycosis that you mentioned it's a fungus. It's a fungal infection. So, for example, fungal infections of the skin, ringworm, right? If they which we call tinea corporis. If it's on the scalp, it's tinea capitis. But if in the fingernails, for some reason or another, it's called onychomycosis. But yeah, those are fungal infections.
Okay, so Dr. Wilson, what we commonly call athlete's foot or jock rash.
Yes.
Now, is that a fungal infection?
Yes.
Okay, so how or why does fungus that may be everywhere, how does that cause an abnormal contamination or colonization or infection? But for example, we might think that all around a locker room, whether it's the guys' locker room or the girls' locker room in high school, say, I suppose the fungus is all over the place.
Correct.
But not everybody gets athlete's foot, and it doesn't happen year round. So how is it? What are the circumstances that lead to a fungal infection?
Increased moisture in particular. Fungi love moisture. They love moist environments. So often the deciding factor between someone who gets it and someone who doesn't, even though both people have been exposed, is how well they dry off after their shower. Believe it or not, it's something that simple. If the folds of your skin, wherever they are, remain moist, it's a good growing ground for the fungi.
Okay, so I remember back in CYO basketball in the 6th and 7th and 8th grade, our coach admonished us to take the towel and dry between the toes very well.
Yes.
Correct?
Yes. And powder, right? Some coaches will also recommend using powder on your feet because that also dries them.
Okay. So similar to a plant, we know certain plants need the right soil and fertilizer and sunlight and water. Fungus need certain circumstances and a certain milieu to invade or thrive or reproduce. Isn't that correct?
And they're particularly sensitive to that humidity. That high moisture content is particularly important.
Okay. So Dr. Wilson, you mentioned specifically valley fever. Now, is that coccidiomycosis?
Correct.
Okay. So, as an aside, there was a plastic surgery chief resident who published a paper on direct inoculation of coccidiomycosis in a car accident, as a unfortunate little boy was tossed out of the car into some sand, and on the side of a hill there was some coccidiomycosis that directly inoculated the skull, leading to an osteomyelitis.
Wow.
That chief resident was, in fact, David Morwood. So we published that paper from Children's Hospital, Los Angeles, with Dr. Larry Nichter. So a fungus can actually get inside the tissue and invade, correct?
Just like a bacterium, if the skin defense mechanisms, the number one being the mechanical integrity of the skin is a huge barrier to infection, and if that mechanical integrity is disrupted, that can lead to an infection. Yes.
Okay, so Dr. Wilson, we talked about, in summary, a bacterial infection, staph and strep, etc., responding to antibiotics. For the common cold, there's not really an antiviral agent. There are some newer antiviral agents like a famciclovir for certain herpetic infections.
Correct.
Now, there is a Tamiflu, I think.
Yes.
Now, that can slow down and stop some viral reproductions, etc., right?
Particularly influenza.
Influenza. Okay. Now, if someone is unfortunate enough to get a fungal infection, what do we do about that? What can doctors do?
So there are antifungals, and when I was in my early training days, pretty much the only one was a drug called amphotericin, and it had so many side effects, we called it amphoterrible. And we only used it for deep, life-threatening fungal infections, and not anything that wasn't life-threatening, because the side effects were likely to be worse than the disease itself. But now we have the conazoles, ketoconazole, fluconazole. Those are about as effective as amphotericin, but far less side effects. So it's much easier to treat fungal infections now than it was 20 years ago.
Okay. Now, Dr. Wilson, we mentioned what's commonly caused as athlete's foot. Men and women can get that.
Yes.
Jock rash. Typically, we talk about a male athlete getting that.
Right.
But women can get a yeast infection.
Correct.
Right? Now, is a yeast infection a fungal infection?
It is, but what it is for example, there's normal flora in the vagina as well. Any part of the body that's open to the outside world is going to have normal flora. The vagina is normally a mixture of bacteria and yeast is a form of a fungus. If that balance is changed, typically the most common situation you'll hear about is if a woman's taking antibiotics, which kill off a lot of the bacteria. It allows an overgrowth of the normal yeast that are normally there, but they overgrow.
Okay, so that's why sometimes I have women patients who tell me, Dr. Morwood, if you're going to give me antibiotics, then I should also get a treatment for yeast infection.
Correct.
Just to prophylax that overgrowth of the yeast. Isn't that correct?
Yes. Some women know that every time they take antibiotics, it happens to them.
Okay,
but it's variable. Everybody's different.
Okay. Now, what about the more serious infections like valley fever? You talked about coccidiomycosis. Now, can't that get into the lungs,
It
et
sure
cetera?
can. It sure can.
And that's a problem.
It can be very serious. It's interesting, though, that it's estimated that about 60% of the people who have been exposed to valley fever at some time in their life, and you can tell that by doing a blood test for antibodies. Remember, antibodies are the reaction to an organism. About 60% of the people who have antibodies to valley fever, meaning they have been exposed, have no recollection of ever having been sick. And about 40% of them say, well, I had a flu one time, and I didn't know what I had, a flu-like syndrome, but it was very strange, and I had joint aches, but then it went away. It's estimated that only about 5% of people who get exposed actually get a pneumonia, but it's a very serious pneumonia. And then it can also, in about 1% of patients, it can spread to other locations, lymph nodes, but it can spread to other organs and even to bone and cause fractures.
Wow, sounds like it's serious.
It can be very.
So, in summary, Dr. Wilson, we talked about bacterial infections. We talked briefly about viral infections. We have received an introduction to fungal infections. We talked about yeast and jock rash and athlete's foot, etc. And we've mentioned that they're thankfully, now better treatments for fungal infections.
Yes.
Dr. Hugh Wilson, you're an excellent teacher. I hope you come back again. Every time you're on the program, I learn a lot. Thanks for being here.
I'd love to come back.
Excellent. Once again, I'm Dr. David Morwood. I am a board-certified plastic surgeon right here on the beautiful central coast of California. We're going to take a very brief pause for a very good cause. I hope you will stay with us.
It's scary making the decision to have reconstructive surgery, but it's so worth what you get out of it.
I'm stress-free. I know I'm not going to get breast cancer.
Everything is back to normal, and it really did not take long to bounce back.
I have a sense of hope for other women that this surgery can help them to live normal lives.
This year, more than 200,000 women in this country will be diagnosed with breast cancer. For many of them, a mastectomy or removal of the affected breast will be recommended as part of the cancer treatment.
The idea of losing a breast for some women can be almost as difficult as being diagnosed with breast cancer. Modern breast reconstruction can help. The purpose of this presentation is to provide women with valuable information about the major issues in breast reconstruction.
We'll have an opportunity to speak with women who chose different methods of reconstruction. We'll talk to experts in the field of breast cancer, and we'll let you know your options for breast reconstruction.
I embraced the mastectomy and reconstruction procedure, and because of that, I had a terrific outcome, and it's changed my life in a positive way.
For the thousands of women who will be diagnosed with breast cancer this year, we understand this is most likely a troubling and frustrating time. We hope this presentation's been valuable to you and will help you make some very difficult decisions that you're facing.